Hey guys, it's been a rough couple of weeks. I mentioned in a previous video that I was in the middle of like wrapping up my senior year at the university, and yesterday was graduation, so I finally completed my bachelor's degree in communication sciences and disorders. So it's been kind of a hectic couple of weeks trying to wrap up like projects and finals and all of that. But I'm gonna make another video in a bit talking about like my career goals and academics and all that. This video is mostly focused on mental health and medication update. As many of you know, I have cerebral palsy as well as ADHD, generalized anxiety disorder, and major depressive disorder. And for the past month or so, I was on Vyvanse, 20 milligrams of Vyvanse. And I'm sorry if this is TMI or too much information, but it was causing digestive issues, heartburn, and diarrhea. I've had diarrhea for like the past 2 weeks. So I had um, an appointment with my psychiatrist, I think on a Wednesday, and I let her know about my digestive issues that I was having, and she said she hadn't heard of anybody having those issues with Vyvanse. But when I Googled the symptoms, diarrhea is on there as a possible side effect. And then I also told her what I had mentioned to you guys in a previous video about how about 2 or 3 in the afternoon I feel like the medication's starting to taper off and it's causing like these really low mood, almost depressive episodes. And she did say that she has heard that from other patients complain about the same thing, about like the low moods in the middle of the day. And then my depression is coming back again. I do have major depressive disorder, so there really is no rhyme or reason for why I feel this way. In fact, if anything, I should be like overjoyed and happy because I completed my bachelor's degree, right? And I even got accepted to the master's program at the undergraduate program that I was attending. So I got accepted to their master's program, which I will be starting in August. And my goal is to become a speech language pathologist. And in order to do that, I do need to complete my master's degree. So I should be happy, right, that everything's kind of falling into place. But for the past week or so, I've been really, really depressed for no reason at all. And I'll have like my family members and my sister will be like, well, what's wrong? I feel, I can tell, I can sense that you're depressed. I can kind of sense your low moods. And yeah, that's why it's called major depressive disorder, right? Because there is no particular rhyme or reason. It could be genetic, it could be like a chemical imbalance in the brain. I don't know. The point is that it just is, and it happens. And I've gotten pretty used to kind of noticing when I'm starting to go downhill into a depressive episode. So when I talked to my psychiatrist, I told her I I need to get back on antidepressants because I have been really, really depressed. Um, and so she put me back on trintellix, which I was on. I believe I tried it last year, and it didn't really work out. But at this point, I feel like I've tried just about every antidepressant that there is to try. So she took me off Vyvanse and she put me back on 5 milligrams of trintellix, which I think I started on Wednesday. And 5 milligrams really seems like a low dose, but she said that since I have so many kind of digestive issues and my body doesn't always respond well to medication, she wanted me to start off kind of low. And then she also put me on Adderall. So Adderall is for the ADHD, and it's a stimulant that I have not tried. I've tried Ritalin. I have tried Vyvanse, which is the one that I'm on right now. I took my last pill this morning, and I think on Monday I'm probably going to start on Adderall. She sent it over to the pharmacy, but they hadn't approved it yet, so I'm hoping they get that worked out by Monday. And I've tried Wellbutrin. I've tried. I know Wellbutrin's not a stimulant, but I've I'm trying to go through the medications I've tried for the ADHD. Strattera, just a bunch of them, and you'll see them reviewed on my channel, and kind of as I try them, and what did and didn't work out. So I guess she thinks that if we try a different combination of medication, like in this case, Adderall for the ADHD and trintellix for the depression, then it might work out. I really don't know. I guess we'll give it a shot. Another thing that I've been struggling with lately is body image. I have never weighed this much in my life, and I know the medication, particularly the Zoloft that I was on a couple of months ago. I know that one for sure makes me gain weight, and it's really hard to kind of shave off those pounds or go back down and lose the weight. Even if I eat healthy, even if I like exercise, doesn't seem to work for me. And so I've never weighed this much, and I've never been this big. Um, and I've never really had body image issues like that. I mean, I've been self-conscious about the way that I walk, that how I limp because of my cerebral palsy, and I have social anxiety, so I get kind of nervous about that. But I've never had body image issues where I feel like I'm overweight and it's bothering me. And at this point, my graduation was yesterday, and I took a couple, like maybe two or three full body pictures, and I just did not like what I see. I didn't want to post them like on social media and stuff because I don't like what I see. Like, I don't like how big I am and how big I'm getting. And I'm sorry, I don't mean to trigger anyone. I just have to be honest with myself and where I'm at, because this is a like mental health and personal vlog. And so I need to have this for reference so I can go back to it later and see, okay, this is what was bothering me, or this is where I was at, at this point in time. Um, so I'm sure there are a lot of people out there who struggle with body image. I'm not the only one. But for me, this is new. This is not what is causing the depression necessarily. Like, it does make me a little bit upset, I guess, but not to the point where it's going to make me depressed. The depression, the depressive episodes, like I said, they just come and go. And I just happen to be falling into one at this point in time. So I guess it's a good thing that I started back on the antidepressants. And it's also a good thing that I have a break from school until August, when I go back and start my graduate program at the University of Redlands. Um, I still have to work though. I work part time as a reading specialist. So I go into people's houses and I tutor kids who have like learning disabilities and help them with reading and all of that. So I don't know. It's been hard. My office is a mess. My room's a mess. There's a lot that I want to do, but I just can't get around to doing it. So maybe now that I have a break from school, I'll take the time to do some self-care, and then also get a few things done, right? Try to get my life in order before I have to start graduate school, because then I have to, in graduate school, I have to do uh, full-time units. So it'll be like 4 classes. And on top of that, I have to do clinicals that I have to complete, like 400 hours of clinical work as a practicing student of speech language pathology. So it's going to be tough. I mean, getting my bachelor's degree was tough enough as it is, and I didn't even have to do clinicals and that type of work. So I know that come August, late August, when the master's degree starts, I'm going to have to be more organized and hopefully be in a much better mood so that I can get things done, right? And yeah, so anyway, Monday, I'm hoping that I'm going to be starting on the Adderall. I don't remember what I want to say maybe like 5 milligrams. I don't remember what the dosage is exactly, but I'll talk about it when I get it. And then I'll continue on with the trintellix. So yeah, today's the last official day of me taking Vyvanse, I guess, and I will be back.